Hello, Medicos. Good day to all of you. This is Dr. BK for you, and in today's session, I will be discussing about the blood supply of the brain. So, in this series of neuroanatomy lectures, and this is the final lecture on the neuroanatomy. So I hope I have actually covered all the aspects of the neuroanatomy. Now first, coming to the learning objectives for today will be a short introduction about the blood supply of the brain. So then mainly we are going to discuss about the two arteries which supply the brain. So mainly the branches of these two arteries. One is the internal carotid artery, which is from the carotid system of arteries, which supplies the brain. Okay, so mainly the internal carotid artery actually supplies your cerebrum structures. So mostly, not all, completely 3/4 of the cerebrum structures, and also the deeper part of the cerebral intracerebral nuclei, and then anterior part, mainly anterior part of your thalamus and hypothalamus, that is your diencephalon. Whereas the next system of arteries, mainly your vertebrobasilar arteries. So this actually mainly supplies your brain stem structures and hindbrain, mainly hindbrain brain stem structures, and some part of the cerebrum, especially your occipital lobe, and of course your spinal cord. So this is your internal carotid artery. To be very broadly tell, it supplies the anterior superior part of your brain, whereas the vertebral system artery supplies your posterior and inferior part of your brain and the spinal cord. So mainly we are going to discuss about these two arteries and clinical aspects here and there, because most of the clinical aspects we have already discussed in the respective regions. For example, in the brainstem, all the vascular lesions, what is medial medullary syndrome or what is lateral medullary syndrome. Then we have discussed about the Benedict's Weber's syndrome. So brainstem, all those things. Okay, and same way in the cerebellum, also thalamus, all the vascular lesions, because mostly defects in the nervous system, especially acquired, apart from the congenital defects, the acquired are mainly vascular lesions. The first thing mostly which occurs is the majority of the cases which we come across, whether it is the motor or the sensory deficit, is mainly through the vascular lesions. Then second comes about the second factor which accounts for most of the deficit comes because of the growth. So tumors, okay, so neoplastic growths, okay, so that is tumors of the brain, they actually fall under the second category. Then the other things only comes along the third category. Okay, so with respect to the electrical brain activity, defect in the electrical brain activity, which accounts for seizures or abnormal psychiatric behavior. Okay, so with this short introduction of the learning objectives, okay, and finally, of course, I will also be enumerating the veins which are actually draining the brain, that is your cerebrum, cerebellum, and the brain stem. So first of all, the blood supply to the brain is very important for its survival of the tissue. Okay, so because the nervous tissue, especially the brain tissue, cannot survive without the blood supply, and it is a place where high activity and continuous activity is taking place. So your brain is around, for example, your cerebrum, cerebellum, and your brainstem accounts for only 2% of your total body weight. So for example, roughly estimating, if you are just 60 kilo, then naturally uh, what happens is your brain should be around 1200 grams. So just 2% of the total body weight, but 20% it requires. So 10 times more amount of oxygen is actually utilized by the brain. So a continuous supply of oxygen is necessary because high metabolic activity is taking place, which we are mostly unaware of it. We think that only when we do some physical activity, exercise or something, what happens is like our muscles get what do you call, very much tired, exhausted, and or your fat is burned, and of course we move our bones and all those things. We don't think even at that time, for every physical activity our brain is working, giving instructions and taking information, receiving information. So this is not only during physical work, okay, and this is greatest when during when you are actually engaged mentally. Example, while playing a musical instrument, reading a book, solving a puzzle, all those things, high amount of what happens is neurochemical activity, electrical activity is taking place, and for this the supply of oxygen is very essential. So it utilizes more than actually 20%, so 10 times more than its weight it utilizes. And so the muscles can actually store energy, okay. So for example, glucogen or glucose can be stored in the liver, okay, in your GIT, or your muscles can store the energy, okay. But in case of brain, there is no storage mechanism, so it is all used up. Whatever the energy is actually supplied to the brain, there is no storage mechanism, and it is immediately used. So that is why within 10 seconds of cessation of blood flow to the brain, okay, consciousness actually ceases. So for 10 seconds, what happens is if it if the blood supply is cut off to these brain structures, then what happens, you started losing consciousness. So that is why, and sometimes you are also not aware of it when this takes place. Especially, nowadays we are all using lot of what do you call, air conditioners. So there is, we can tell, almost every house has a air conditioner, and we travel in cars which is all again air conditioned. So what happens is when we sleep without our knowledge itself, sometimes if there is a what do you call, short circuit, or sometimes a malfunctioning AC can actually release toxic fumes, and that might increase your carbon dioxide levels in the circulating blood when it reaches the brain. So it is very toxic to the brain, and naturally what happens is death ceases, especially your respiratory centers and cardiac centers in the brain. Um, what happens if there is an interference of oxygen supply, this takes place, okay. So let us not go much into those details. So irreversible change takes place within 4 minutes, within 4 minutes of blood flow, and completed by 10 minutes. So and completed by 10 minutes. So this as a clinician, definitely you are all budding clinicians, so you should know this, it because especially with respect to the two things we speak about called as the golden hour, okay. So the golden hour is actually considered at two places. One is ischemia to the heart, okay. So ischemia to the heart, a person who suffers a cardiac arrest, okay, so mainly myocardial ischemia. So the first 1 hour they tell is very critical, because that is muscle tissue. You're able to understand. So if the myocardium, what happens is there is an ischemia, loss of blood supply, then irreversible damage to the myocardium can take place. Okay, but still more sensitive is your brain. So stroke. So what happens, the first 10 minutes of the stroke is very important. It is a golden hour. Immediately medical attention actually has to be given. Otherwise what happens is the person might actually end up with the deficit, motor or sensory deficit for the rest of his life. Okay, and so there are symptoms mainly. That is why there are so many symptoms which shows there is going to be a stroke. So like slurring of speech or a deviation of the tongue. Are you able to understand? Or sometimes a slight imbalance or in coordination. So all these are symptoms which warn you, and naturally you should be vigilant enough to recognize these symptoms and immediately seek medical help. That okay? So these are symptoms that a stroke is due to onset. So most common cause of stroke, you know very well, is uncontrolled blood pressure, hypertension. Okay, so the hypertension, what happens is mainly it affects the peripheral vessels. So the peripheral resistance increases. So naturally what happens, these small vessels in the brain, when they rupture, it might lead to cerebral hemorrhage or ischemia. So other peripheral places near to your body wall, even if it ruptures, it is not going to create much what do you call disturbances. But when these small vessels which are entering the brain, when it is of high pressure, it might immediately rupture or burst, leading to the stroke. So one cause is uncontrolled hypertension or thrombosis, blockage of these vessels, the second type. So these two are the main things which actually leads to the stroke. So coming to the arteries of the brain, mainly the arteries of the brain, two system of arteries supply the brain, arterial trunk. So one is the carotid system of arteries, the internal carotid artery, and other one is the vertebrobasilar system. So that is the vertebral artery uniting to form the basilar artery. So one is the internal carotid system and other one is the vertebrobasilar system. So from these, internal carotid and vertebral arteries are the two major arterial trunks which actually supply the blood to the brain. So first we will be discussing in detail about the internal carotid artery. So it is actually one of the terminal branches of the common carotid artery. Okay, so one of the terminal branches from the common carotid, common carotid is actually from the arch of aorta. The left common carotid is actually from the arch of aorta and right one is from the brachiocephalic trunk. So at the level of fourth cervical vertebra, the common carotid artery bifurcates into two terminal branches. One is the internal carotid and other one is the external carotid. So internal carotid artery is called as internal because it runs inside the skull. But along its course in the neck, it is not internal or medial to the external carotid. Actually, in the neck or in the cervical region, it is the external carotid which is more medial than the internal carotid. So you should not get misled by the term that internal carotid is medial. Actually, it is called internal carotid because it supplies the structures inside the skull. Okay, so it has got mainly four parts. Okay, so we will be discussing about these four parts. Originates in the cervical region, and then what happens, it is seen within the carotid sheath, modification of deep cervical fascia in the neck. Okay, mainly it is seen in the carotid triangle, and then what happens, it ascends up in the neck and enters the carotid canal by passing through the carotid canal. So four parts mainly you are able to see: the cervical part in the neck, and followed by that is the petrous part. So this part is actually called as the intrapetrous part or petrous part. Okay, and the third part is actually the cavernous part. C3 it is labeled. So here you are able to see that is the cavernous part, and the fourth part is the cerebral or supraclinoid part. Okay, so four parts. So mainly the first three parts we are not going to discuss much, because already in the head and neck we have discussed about the cervical part and the petrous, and of course the intracavernous part in the respective topics, especially in the cavernous sinus and intrapetrous part also we have discussed, especially while discussing about the middle ear, and also your pterygopalatine fossa, because artery to pterygoid canal and caroticotympanic nerves are all given at this intrapetrosal level, of course. And so today we are mainly going to discuss about the supraglenoid part. So before that, short definition about these parts. So here you are able to see the cervical part. Okay, so after its origin, from the common carotid bifurcation, it is running in the carotid sheath, so up to the carotid canal. So the lower end of the carotid canal, you are able to see here. So the carotid canal itself is present within the petrous part of the temporal bone. So within the petrous part of the temporal bone, you can see the carotid canal. So the lower opening of the carotid canal, you can see in the base of the skull, norma basalis. But the upper end of the carotid canal, you will not be able to see, because it opens into the posterior wall of foramen lacerum. So it opens into the posterior wall of the foramen lacerum, and then what happens immediately? It runs in the cavernous sinus. So you are able to see within the cavernous sinus, it runs from the posterior to the anterior end of the cavernous sinus. So here it is separated from the venous blood only by the endothelial lining. Okay, only the endothelial lining. And this cavernous part shows an S-shaped bend or curve that is called as the carotid siphon. Okay, that is called as the carotid siphon. Now why actually this carotid siphon is necessary? Because it dampens the arterial pulsations. Okay, so mainly to dampen the arterial pulsations a bit. Okay, it is in the form of an S-shaped curve. Then, so coming to the supraglenoid part, mainly cerebral part, it is also called as the supraglenoid part. So here you are able to see here, medial to the anterior glenoid process, it turns above from the anterior end of the cavernous sinus and pierces the dura mater and enters the subarachnoid space. And the two terminal branches of the internal carotid artery, cerebral part, is your anterior cerebral artery, and other one is the middle cerebral artery. So of these two, of course, the middle cerebral artery is the larger terminal branch. Okay, so the cerebral part actually divides into your anterior cerebral artery. This is your anterior cerebral artery, and other one is the middle cerebral artery. So these are the two terminal branches. So now actually coming to the other branches in the cerebral part, we will see these other branches in the cerebral part, and then actually we will pass on to the two terminal branches, which is very important. So branches mainly in the supraclinoid or cerebral part includes first your uh, superior hypophyseal artery. Okay, so this is your actually your cerebral part, which you are able to see here. It gives two terminal branches. Okay, so the two terminal branches will be your mainly your middle cerebral and the anterior cerebral. So before that, you are able to see it is giving superior hypophyseal artery. So this is the artery which is supplying your pituitary gland, mainly your adenohypophysis. So it takes part in the formation of your hypophyseoportal system. Okay, so hypothalamo-hypophyseal portal system. So that is mainly supplied by the superior hypophyseal artery, which is a branch which is given from the cerebral part. Then one more branch which you are able to see here is the ophthalmic artery. So ophthalmic artery, again in detail we have discussed in the orbit. So mainly it supplies the structures in the orbit. So and then of course it gives a very important artery, that is a central artery of the retina, which travels along with the optic nerve and supplies mainly the posterior 3/4 layers of the retina. So it is an end artery, central artery of retina, because if the central artery of retina is blocked, naturally blindness results. So one is the superior hypophyseal artery we have seen here, and other one is the ophthalmic artery. Then other two branches we are going to discuss. So before that, you are able to see the petrous part is giving other branches. Mainly it gives caroticotympanic nerves, which is going to enter the carotic the tympanic plexus, taking part, sorry, caroticotympanic arteries, not the nerves. And then it also gives artery to the pterygoid canal. So here you're able to see the artery to pterygoid canal, caroticotympanic nerves, which is actually given by the petrous part. Okay, then it also gives ganglionic branches to the trigeminal ganglion and some meningeal branches also. Okay, so let us not go much into that details, because we are concentrating mainly on the cerebral part. Okay, so the next artery which we are going to discuss is the posterior communicating artery. So here you are able to see from the internal carotid artery, one artery passes posteriorly, and that is called as the posterior communicating artery, that will anastomose with the posterior cerebral arteries. So the posterior cerebral arteries are actually they are the two terminal branches of the basilar artery. Okay, they are the two terminal branches of the basilar artery. So posterior communicating artery is an important communicating channel between your internal carotid and your vertebral system, vertebro-basilar system of arteries. So posterior communicating artery connects your internal carotid with the posterior cerebral artery. Okay, so sometimes this artery might be large and might be mistaken for posterior cerebral artery. Okay, so posterior cerebral artery. The next branch is mainly, so as I told you, this is about the anastomosis, and I will come to the circle of Willis after a short while, after describing your internal carotid and vertebro-basilar arteries. Okay, perforating branches, or it gives certain branches, ganglionic branches, this posterior communicating artery. So mainly with the similar branches of the posterior cerebral, it gives mainly branches to the thalamus and also along the walls of the third ventricle. Okay, so that is your posterior communicating artery, which you are able to see here. And when you look at the here, this is your internal carotid artery, and that is your posterior cerebral artery from the basilar artery. So both are actually connected by the posterior cerebral artery, and that posterior cerebral artery is posterior communicating artery is giving certain branches. You are able to see that certain branches similar to the central branches, deeper branches of the posterior cerebral artery. So it is going to supply your medial part of thalamus. So you're able to see that posterior expanded part is actually your thalamus. So medial part of thalamus, and of course more medially you will have the third ventricle, and you very well know that thalamus forms the lateral wall of the third ventricle. Okay, thalamus forms the lateral wall of the third ventricle. Then one more important branch which we are actually going to discuss is the anterior choroidal artery. So this is also one of the direct branch from the internal carotid artery. So direct branches what we have seen is the superior hypophyseal artery, ophthalmic artery, Then we have seen about the posterior communicating artery. Then now we are going to discuss about the anterior choroidal artery. So you are able to see the anterior choroidal artery in close proximity with the posterior cerebral artery. So it is in close proximity with the posterior communicating artery. It runs backwards, okay, intimately related to your optic tract. So optic chiasma, and then what you are able to see is the optic tract. So closer to the optic tract, it runs, and see it is forming the choroid plexus of the lateral ventricle, where inferior horn of the lateral ventricle. Okay, so the inferior horn is seen in the temporal lobe. So it mainly takes part in the formation of the choroid plexus for the inferior horn. So inferior horn choroid plexus is mainly formed by the anterior choroidal artery. Okay, whereas the upper part, again to the upper part of the lateral ventricle, the choroid plexus, which you see in the central part of the body, and the choroid plexus for the third ventricle is mainly from the posterior choroidal arteries. Okay, this is anterior choroidal arteries taking part in the choroid plexus of the inferior horn of the lateral ventricle. So does it supply any other structures apart from this, what do you call, this inferior horn of the lateral ventricle? Yes, it mainly supplies so many areas. Your part of caudate nucleus, thalamus, since it is running near, very intimately related to the optic tract, definitely it supplies your optic tract. And posterior expanded part, your lateral geniculate body, definitely, which is the relay center of the optic tract. Then your optic radiation, inferior horn, so naturally it should supply your uncus, hippocampus, amygdala. Okay, and then it also supplies your posterior limb, internal capsule, posterior limb of your internal capsule, and your retrolentiform part of your internal capsule. Okay, so here you are able to see your anterior choroidal artery. So that should be your brain stem, especially your midbrain. Okay, the red nucleus and the cross cerebri you are able to see here. The optic chiasma, optic tract, and then optic radiation. Okay, so that is your optic radiation. So your anterior choroidal artery intimately related to your optic tract. So naturally it will supply optic tract and your mainly your lateral geniculate body, and then your optic radiation. Okay, and then of course, as I told you, see here the area supplied mainly by your anterior choroidal artery is the anterior part of the posterior limb of the internal capsule, and your retrolentiform part of your internal capsule. Not only that, it also supplies part of your globus pallidus and putamen. Okay, and then to some extent also the thalamus. Okay, so that is the anterior choroidal artery, okay, which is a direct branch from your uh, internal carotid artery. So mainly in respect to the internal capsule, part of your posterior limb, retrolentiform part. So this part you should definitely remember. Okay, anterior choroidal artery. Okay, so next, this artery is also called as cerebral thrombosis because of its small size of the lumen. Mostly thrombosis tend to take place in this anterior choroidal artery. Okay, so next we are moving on to the two terminal branches of the internal carotid artery. So the first one is actually your anterior cerebral artery. So this anterior cerebral artery is, as I told you, one of the what do you call? It is actually the one of the terminal branches of your internal carotid artery, anterior cerebral artery. Okay, so begins mainly at the medial end of the lateral sulcus. So this is your stem of the lateral sulcus, and then it goes like this as posterior ramus, and then you have anterior horizontal, anterior ascending ramus. So at the medial end of the what do you call, the uh, lateral sulcus, you can see the anterior cerebral artery, and then runs anteromedially along to reach the medial longitudinal fissure. So between the two cerebral hemispheres you have the medial longitudinal fissure. So here it runs almost to the medial longitudinal fissure. Okay, and it is connected with the opposite anterior cerebral arteries. Two anterior cerebral arteries are actually connected with each other by this anterior communicating artery. Okay, so it is actually connected by the anterior communicating arteries. Okay, so it forms mainly your rostral part of the circle of Willis. So that is your anterior part of the circle of Willis. So again I will repeat that circle of Willis we will be seeing within a short while. So after this internal carotid branches and the vertebral artery branches. So mainly it ends by anastomosing with the branches of the posterior cerebral artery in the medial surface of the cerebral hemisphere. The medial surface of the cerebral hemisphere. So let us just try to understand the branches. So they consist of both the central as well as cortical branches. So cortical branches mainly what do you mean by they supply the uh, cerebral cortex. So not only the gray matter, they also what happens they might go deeper into the core of the white matter and they supply. So you have short and long branches, cortical branches. Okay, so some of these are short, as I told you, they end within the gray matter, while others are actually long and they enter into the subjacent white matter. Okay, so these cortical branches will anastomose with each other on the surface of the brain. But these branches, both the perpendicular branches which run right angles to these cortical branches, which enter deeper, they are actually end arteries. They don't actually anastomose with each other. So this is with respect to cortical branches of any artery, whether it is anterior cerebral, which is going to give these branches, or middle cerebral or posterior cerebral, because these three arteries only mainly supply your cerebral cortex. Okay, so first let us try to understand the central branches. So here you are able to see the anterior cerebral artery. So it mainly gives off certain central branches. Okay, so the central branches they come under even your circle of Willis group of branches, mainly your anteromedial group of branches and anterolateral group of branches. So one of the main branch, central branch, is your recurrent artery of Hubner. Okay, so here you are able to see the recurrent artery of Hubner. Okay, so that is your recurrent artery of Hubner, mainly coming from the anterior cerebral artery. They are central branches, which means they are deep branches. Okay, they are called as striate arteries because intimately related to this corpus striatum, your caudate nucleus and the lentiform nucleus. So you have striate branches from your anterior cerebral as well as from your middle cerebral. So this is actually the medial striate branches are from the central branches of the anterior cerebral artery. It is called as the recurrent. It is called as the recurrent artery of Hubner. Okay, so now it is actually proximal to the anterior communicating. Before the anterior communicating artery gives, it gives this recurrent artery of the Hubner. Okay, now what all this recurrent artery of Hubner supplies? So mainly it supplies part of your internal capsule and caudate nucleus. Okay, so definitely it is going to supply your medial part of this your caudate nucleus, then part of your internal capsule, and then part of your lentiform nucleus, that is your putamen. Caudate nucleus and putamen forms one functional caudate nucleus and putamen forms one functional unit. Okay, so mainly just I was describing about this recurrent artery of Hubner. Mainly it supplies part of your caudate, medial part of caudate nucleus, putamen, and septal nuclei. So you know what is septal nuclei now, which is present in the septal region. Only in the last lecture in the limbic system, definitely you would have actually come across this septal nuclei, mainly which receives projections from the amygdaloid nucleus. Okay, uh, so coming to back to the recurrent artery, the central branches mainly supply your internal capsule, putamen, and parts of your uh, septal nuclei. Okay, so it supplies the anterior limb and genu of the internal capsule. Okay, so anterior limb and genu is supplied mainly by your anterior cerebral artery, recurrent artery of Hubner. So just now we saw about the anterior choroidal artery. We have seen about the anterior choroidal artery, which are supplied your posterior limb and retrolentiform part. This part of anterior limb and genu is actually supplied mainly by this uh, recurrent artery of Hubner. Cortical branches, so which is very very important again, they can be classified into orbital branches. Okay, so they can be actually classified mainly into orbital branches, which is the orbital surface it supplies. Okay, then it can be, you have frontopolar branches. Frontopolar branches, mainly medial surface of the frontal lobe. Okay, you have frontopolar branches, and then you have pericallosal branches and calloso-marginal branches. We will see one by one. So mainly the orbital branches will actually supply your medial surface, medial part of the orbital surface. Okay, and mainly they supply the frontal lobe. Okay, so medial orbitofrontal artery. So that is going to supply your orbital surface of the frontal lobe, medial part. Then calloso-marginal artery, which you are able to see here, that is your calloso-marginal artery. Now what happens after this? Uh, the anterior cerebral artery runs along the medial longitudinal fissure. So it winds around the genu of the corpus callosum, rostrum of the corpus callosum, and then it turns like that above the corpus callosum. So mainly it is related to the corpus callosum. So of which one artery is the calloso-marginal artery, which you are able to see here. So it mainly supplies one important area is your paracentral lobule. Okay, so it actually supplies your paracentral lobule and then your cingulate gyrus. Paracentral lobule is here. So the along the central sulcus, the medial surface around the central sulcus is actually called as the paracentral lobule. So that is mainly supplied by your calloso-marginal artery. Okay, and also it supplies your cingulate gyrus. Okay, then the remaining part, actually the next branch what you are able to see is the pericallosal artery. Okay, so that artery which you are able to see is the pericallosal. Peri means periphery of the corpus callosum. So outer border of the corpus callosum you are able to see. That is why it is actually called as the pericallosal artery. So that mainly actually terminal branch of the anterior cerebral supplying your corpus callosum. Okay, so and also it medial surface of the parietal lobe and precuneus. In front of the cuneus, this area is actually called as the precuneus. This triangular area is called as the cuneus. So in front, the precuneus area and also part of your parietal lobe is mainly supplied by the pericallosal artery. Then apart from that, the cortical branches of this anterior cerebral artery also supplies a narrow strip on the lateral surface, a narrow strip on the superolateral surface. So when you actually look at this central sulcus, you know the motor area and the sensory area is present, in front and behind the central sulcus, precentral and postcentral gyrus. So you know how the homunculus is represented upside down. So naturally in the superior area means, so that should be your leg area. So the leg area, mainly your sensory motor cortex representing the leg area, is actually supplied by your cortical branches of your anterior cerebral artery. Okay, so mainly anomalies include unpaired arteries, so we are not going into those details, anomalies and all. So occlusion brings about contralateral hemiplegia, especially in the lower limbs, because it supplies the lower limb area. And I just now told you our homunculus is represented upside down, our body is represented upside down, so it supplies the lower limb area. And recurrent artery of Hubner, one of the central branch, contralateral face and arm, because the internal capsule, anterior limb and genu part is affected, mainly the fibers to the face and arm, they are affected. Genu also contains your corticonuclear fibers to the brainstem nuclei. So naturally contralateral face and arm paralysis takes place if there is an occlusion of the recurrent artery of Hubner. Okay, then occlusion of pericallosal branch, split brain because corpus callosum. So naturally, if the corpus callosum is affected, you have this split brain syndrome. Okay, so with this, we move on to the next artery, which is the middle cerebral artery. So with respect to the middle cerebral artery, where we are actually going to discuss in detail the branches, the central and the cortical branches of the middle cerebral artery. So the middle cerebral artery, we are actually going to discuss. It is the larger terminal branch of the internal carotid artery. So you are able to see very large terminal branch as compared to the anterior cerebral artery. So passes lateral to the anterior perforated substance. So you have the anterior perforated substance here. That is your olfactory bulb, olfactory tract, which divides into medial and lateral olfactory striae. So in that you have the anterior perforated substance, whereas this part you are able to see the posteromedial, some branches from the circle of Willis is perforating, that is called as the posterior perforated substance. So posterior perforated substance, again we have discussed in the interpeduncular fossa. I think in the midbrain lecture, we have discussed about the boundaries of the interpeduncular fossa, in that the posterior perforated substance, which is present between the two cerebral peduncles. Okay, so coming to the cortical branches, mainly they emerge from the lateral sulcus. So as the artery passes through the lateral sulcus, it spreads to give the cortical branches. So here you are able to see the stem of the or the trunk of the middle cerebral artery, and then mainly it is actually giving cortical branches. So mainly supplies the most of the superolateral surface of the cerebrum. Okay, so your frontal lobe, including your prefrontal area, frontal eye field, superior and middle frontal gyrus. Then your precentral, postcentral area, sensory motor cortex. Then your parietal lobe, inferior parietal lobule, up to the parieto-occipital notch. Okay, in that, because behind that this occipital lobe is actually supplied by the posterior cerebral artery. So excluding the occipital lobe, it mainly supplies your what do you call the frontal lobe, most of the parietal lobe, and also your temporal lobe. So the frontal pole and the temporal pole is also mainly supplied by this middle cerebral arteries, not the temporal pole, frontal and the occipital pole. So you might wonder, actually sir, you just now told me that occipital lobe is supplied by posterior cerebral, but there is an anastomosis near the occipital pole, where the what do you call the posterior cerebral and the middle cerebral artery, they anastomose. The posterior cerebral and the middle cerebral artery, the anastomose near the occipital pole. So mainly most of the superolateral surface it actually supplies, except as I told you, a narrow strip near the superomedial border, that will be supplied by the anterior cerebral artery, that too up to the occipital pole, and beyond that it will be taken over by the posterior cerebral artery. So mainly middle cerebral artery, so much of importance is given mainly because it supplies your sensory motor cortex, okay, of most of the body except the upper part where the leg region is present and the paracentral lobule. Apart from that, your sensory motor cortex, your speech area, your uh, your broca speech, motor speech area, your auditory area, and occipital pole, mainly that area is all under control of this middle cerebral artery. Okay, so that is why a lot of actually what happens is importance is given to this middle cerebral artery. Okay, so supralateral surface except a narrow strip near the supralateral border, and then your occipital and frontal poles. But temporal pole is actually supplied by your what do you call the middle cerebral artery. Okay, so mainly it also supplies through the central branches. It also, apart from the cortical branches, it has these central branches. Okay, so occlusion of the cortical branches leads to hemiplegia. So mainly your corticospinal tract, pyramidal tract is affected, and contralateral hemiplegia in the face, upper extremity, and contralateral sensory loss takes place. Okay, so coming to the central branches, here you are able to see cortical branches ramify over the cortex. The deeper central branches are called as the lenticulostriate arteries. They are actually called as the lenticulostriate arteries. So you have both the medial and the lateral striate branches. Okay, and they enter the anterior perforated substance, and mainly they supply your caudate nucleus and lentiform nucleus. Okay, so they pass on either side, medial and lateral, to the caudate and lentiform nucleus. So that is why they are called as medial and lateral reticulostriate branches. So supplies your caudate nucleus, putamen, lateral part of your globus pallidus, and more importantly it also supplies your internal capsule. So anterior limb and dorsal part of your posterior limb, because ventral part of posterior limb is supplied by the anterior choroidal arteries. So anterior choroidal artery we have seen, then branch from uh, the anterior cerebral recurrent artery of Hubner, that we have seen the anterior limb and genu. Now we have actually seeing one more branch, lenticulostriate branch, from the middle cerebral artery. So that supplies your remaining part of your anterior limb, and the dorsal part of your posterior limb is by this lenticulostriate branch of the middle cerebral artery. It is also called as the Charcot's artery. One of the striate branch is very long and called as the Charcot's artery, or artery of cerebral hemorrhage. Most commonly involved in the cerebral hemorrhage is actually called as the artery of cerebral hemorrhage is the Charcot's artery. One more artery I have seen, cerebral thrombosis, that is the anterior choroidal artery. Okay, so that is mainly about the middle cerebral artery. So with this excuse me, we have completed about the internal carotid system, internal carotid artery. We are going to the vertebro-basilar system. So mainly vertebral artery, which is again a branch from the subclavian artery. So you have two vertebral arteries which is arising from the subclavian artery. This also has got four parts. Okay, so the first part from its origin is seen in the scaleno-vertebral triangle. Okay, and then second part, it is actually called as the vertebral part, which runs in the foramen transversorium of the upper six cervical vertebra. There are seven cervical vertebra, but it runs through the upper six, not through the seventh one. And then third part is actually called as the suboccipital part. So in the suboccipital triangle, it has a transverse course. So winds around the posterior arch of atlas and then enters through the gap between the arch of atlas and the atlanto-occipital membrane. Okay, and then finally the fourth part, only the intracranial part, which you are actually seeing here, enters the foramen magnum. And what happens? It runs on the what medulla, and then at the lower border of the medulla, it actually unites to form a single basilar artery at the ponto medullary junction, which you are able to see here. Okay, so branches from the vertebral arteries, you see anterior spinal artery, two branches, anterior spinal arteries, they unite to form a single anterior spinal artery, and behind you have a pair of posterior spinal arteries. Okay, so posterior spinal artery and anterior spinal artery are mainly responsible for supplying the upper one-third of the spinal cord, because the lower part of the spinal cord is actually reinforced by the segmental arteries. The lumbar arteries, ascending cervical arteries, intercostal, they all give branches, radicular branches. Okay, so posterior spinal artery and anterior spinal artery, which also anterior spinal supplies your medial part of the medulla oblongata. Medial part of the medulla oblongata also it supplies. One is the anterior and posterior spinal artery. Then one more branch of the vertebral artery is the pica, posterior inferior cerebral artery. Okay, so here you are able to see the posterior inferior cerebellar artery is actually called as the pica, largest branch, and mainly it supplies your posterior inferior part of the cerebellum, posterior inferior part of the cerebellum, and dorsolateral part of the medulla, and it is responsible for formation of the choroid plexus. So here you are able to see the dotted lines represents the topographical area of the fourth ventricle. So that is the roof. So the choroid plexus you are able to see here. That is the roof of the fourth ventricle you are able to see here. So that is the fourth ventricle, which is represented in dotted line. So it mainly responsible for contribution of the choroid plexus of the fourth ventricle. Okay, posterior inferior cerebellar artery. Then next, it also the final branch is the basilar artery. So both the vertebral arteries unite to form the single trunk, which you are able to see is the basilar artery. Because it is related to the basi occiput, and that is why the pons itself is called as a basilar part of pons. In the midline of the pons you have the basilar groove which lodges this basilar artery, so formed by the union of two vertebral arteries. The basilar artery gives two branches which bifurcates, that is called as the posterior cerebral artery. So the terminal branch of the basilar artery is the posterior cerebral artery, which you are actually able to see here. So it runs in the basilar part of pons and at the level of midbrain, that is the junction between the pons and the midbrain, it bifurcates into two posterior cerebral arteries. Okay, so what are the branches from this basilar artery? Mainly anterior inferior cerebellar artery. So one of the branches is the anterior inferior cerebellar artery. So it supplies your cerebellum, caudal part of the pons. Anterior inferior cerebellar artery. Okay, so which we have seen here, anterior inferior cerebellar artery mainly supplies your cerebellum, anterior inferior part of your cerebellum. Then superior cerebellar artery. So here you are able to see the superior cerebellar artery supplying your upper part of the cerebellum, and also it gives branches to the midbrain. Okay, so midbrain and rostral part of the pons, superior cerebellar artery. So branches of the basilar artery are anterior inferior cerebellar artery, superior cerebellar artery. Then you are able to see it is giving small branches, and those branches are actually called as the pontine branches. Okay, so those branches are called as the pontine branches, of which one of the pontine branches is a bit large, and it is called as the labyrinthine artery or internal auditory artery. Okay, so the labyrinthine artery or internal auditory artery enters the internal acoustic meatus and supplies the internal ear. So pontine branches, one of them is long and called as the labyrinthine artery. Next, passing on to the posterior cerebral artery. So the two terminal branches of the basilar. This is your basilar artery, which is formed by the union of two vertebral arteries. So the basilar artery finally bifurcates into posterior cerebral artery. Okay, so posterior cerebral artery, terminal branch of the basilar artery. Okay, so runs over the crus cerebri, midbrain, and between the medial and inferior surface of the temporal and occipital lobe, and it receives the posterior communicating artery, okay, from the internal carotid. So you're able to see that is the posterior communicating artery. So this is your arterial circulosis or circle of Willis. So which we are going to see very shortly after this posterior cerebral artery. So now looking at the branches of the mainly your posterior cerebral arteries. So it has got cortical branches. Okay, so the cortical branches consist of mainly posterior temporal branches. Okay, so mainly it consists of your posterior temporal branches, which you are able to see here. Okay, and then it also contains your internal occipital branches. So that can be divided into parieto-occipital and calcarine. So cortical branches mainly supply your lateral surface of the occipital lobe, which is not shown here. I told you because up to this on the lateral surface is supplied by the middle cerebral artery. So beyond that, lateral surface is again supplied by the posterior cerebral artery. So most of the occipital lobe is under the blood supply of the posterior cerebral artery. So whole of the medial surface of the occipital lobe behind the parieto-occipital sulcus, especially this cuneus region. Okay, the cuneus region is actually supplied, and as I told you, divides into posterior temporal, which you are able to see here, which is supplying your temporal lobe, inferior surface, and internal occipital. So this is actually your internal occipital. Which again divides into parieto-occipital branch. So the parieto-occipital branch, and then your calcarine branch. Okay, so the internal occipital mainly gives parieto-occipital and then your calcarine artery. So calcarine artery mainly supplies your visual cortex and sparing the macular region. So it supplies your visual cortex, but sparing the macular region. The macular vision is not disturbed when there is actually occlusion of the posterior cerebral artery. So just a summary of the cortical branches here. You are able to see here the middle cerebral artery cortical branches mainly supplies your frontal, parietal, and your temporal, except a narrow strip over the supromedial border, over the supromedial border supplied by the anterior cerebral. Then behind the parieto-occipital sulcus, occipital lobe is supplied by the posterior cerebral. Medial surface, most of the medial surface is supplied by your anterior cerebral. Behind the parieto-occipital sulcus, supplied by the posterior cerebral, and also the inferior surface, supratentorial part of the temporal lobe is actually supplied by your posterior cerebral. Okay, the occipital and part of your temporal lobe. Okay, whereas middle cerebral artery supplies your lateral part of the orbital surface and part of adjoining your temporal pole, and medial part of the orbital surface is again supplied by the anterior cerebral arteries. Okay, so three different colors to show the area of supply of the cerebral cortex is actually seen in this picture. So other branches of the posterior cerebral arteries, so mainly central branches, So what are the actually the central branches? Posteromedial group. Okay, so the posteromedial group are actually called also as the thalamoperforators. So you're able to see the thalamo geniculate perforators. So these thalamo-geniculate perforators, they are mainly from the posterior cerebral artery, central branches. They are from the posteromedial group, enters the posterior perforated substance. Okay, and then mainly they supply your anterior and medial part of thalamus. So along with the posterior communicating artery and mammillary branch, red nucleus and tegmentum of the midbrain. You also have the lateral group. Okay, so the posterolateral group supplying your pulvinar of the thalamus. Okay, so this part, expanded part, is actually called as the pulvinar with the lateral and medial geniculate bodies, and that will be actually supplied by your posterolateral group of branches. So mainly you also have your choroidal arteries, posterolateral choroidal arteries and posteromedial choroidal arteries. Okay, they are called as the thalamo-geniculate arteries. First one is the thalamo-perforators. This mainly supplies your pulvinar, medial and lateral geniculate bodies. They supply your lower part of the thalamus and also your lateral and ventral group of thalamic nuclei. Okay, the large lateral and ventral group of thalamic nuclei. Okay, ventral lateral group of thalamic nuclei is actually supplied by this posterolateral group. Okay, and this posterior choroidal artery only is responsible for the choroid plexus of the third and also your lateral ventricle. Only the inferior horn of the lateral ventricle is by the anterior choroidal artery, whereas the remaining is by the posterior choroidal artery, and fourth ventricle is by your posterior inferior cerebellar artery, posterior inferior cerebellar artery. So occlusion of posterior cerebral artery leads to contralateral homonymous hemianopia. So one lateral half of the vision is actually excuse me, lost because of the visual cortex. Occipital lobe supplies your visual cortex, but with the macular sparing, because the macular region of vision is supplied by your middle cerebral artery. Okay, so now we are going to see the one of the anastomosis, which is actually called as the circle of Willis. So three main types you come across. One is extracranial and intracranial arteries. Branches of ophthalmic artery, which is from internal carotid, which actually anastomosis with branches of external carotid artery. This you come across in the face and scalp. Supratrochlear, supraorbital arteries, okay, all those things you can see. So let us not go into those details. Next is leptomeningeal. You know what is leptomeningeus? Arachnoid and the dura. So mainly the terminal branches of the cerebrum and cerebellum anastomose here. Okay, this is mainly seen in the subarachnoid space. The next one is only unusual, not commonly seen, is a carotidobasilar anastomosis due to a persistent trigeminal aortic or hypoglossal. These are all developmental. Okay, sometimes you come across. So now coming to the circle of Willis. So this circle of Willis is actually called as the circulus arteriosus. First of all, this is not at all a circle. It is somewhat a pentagon in shape. Okay, so it extends from your interventricular foramen of Monroe anteriorly to the pons, upper surface of the pons posteriorly, and it is situated in the subarachnoid space. Okay, interpeduncular cistern. You know that between the two cerebral peduncles you have the interpeduncular cistern, one of the large subarachnoid space. In that actually it is bathed. The circle of Willis or circulus arteriosus, the base of the brain. So what are the formative branches? Anteriorly, it is formed by the anterior cerebral artery. You are able to see it is formed by the anterior cerebral artery. And both the anterior cerebral arteries are connected by the anterior communicating artery, which is short represented ACOA, anterior communicating artery, anterior cerebral artery. Anterolaterally, as I told you, anterior cerebral, and anteriorly is actually your anterior communicating artery. Laterally, you have the internal carotid artery. Laterally, you have the internal carotid artery, and then posteriorly, what you have is your posterior communicating artery. And then finally, you have the posterior cerebral arteries. Okay, so formative branches are anterior communicating, anterior cerebral, internal carotid, posterior communicating, and posterior cerebral. Okay, so this is actually your circle of Willis. The middle cerebral artery does not take part in the circle of Willis. Okay, now usually blood does not mix the right side and the left side vertebral system, it follows, and definitely there is no mixing of blood. This is only an anastomotic channel when there is actually a block. Then through this anastomotic channel, what happens? Blood might bypass and reach the area of supply. Okay, so that is one main thing which you should understand. So as I told you, very little exchange of blood between your right and left side of your circle of Willis. So the branches, anteromedial, posteromedial branches, two sets. Then anterolateral right and left, posterolateral right and left. So 1, 2, 3, 4, 5 and 6. Six sets of branches you see, but grouped into 4, which is anterior medial, posterior medial, and anterolateral and posterolateral group of branches. So that is what you are able to see here: anteromedial, anterolateral, posteromedial, and posterolateral. Anteromedial mainly from the anterior cerebral and anterior communicating. So it is mainly from the anterior cerebral and anterior communicating branches. Okay, so the anterior medial group, one main artery, recurrent artery of Hubner, which we have discussed in detail. Okay, so next, anterolateral group. So the anterolateral group mainly consists of your striate arteries, lenticulostriate arteries. Okay, so you might wonder, sir, you told mainly uh, the middle cerebral artery is not involved in the circle of Willis formation. It is not involved in the formation, but there is a, what do you call, it takes part in the anastomotic branches. Okay, so mainly the recurrent artery of Hubner, okay, from the anterolateral group. Then posteromedial group, with respect to the posteromedial group, here you are able to see here uh, between the mostly junction of the posterior communicating and posterior cerebral arteries gives rise to your posteromedial group. So they mainly supply your thalamus and all those things, mainly structures on the floor of the third ventricle, tuber cinereum, mammillary body. Okay, mainly your tuber cinereum, mammillary body, hypothalamus. So thalamo-perforating arteries, medial and anterior parts of the thalamus, thalamo-perforators, as I told you. Then posterolateral, mainly from the posterior cerebral arteries, they supply your posterior part of the thalamus, pulvinar of thalamus, medial and lateral geniculate bodies, and also your large lateral and ventral group of thalamic nuclei. So these branches, what has been grouped into under the circle of Willis, we have already discussed separately under the respective arteries. The anterior cerebral artery, definitely we have discussed about this anterolateral, anteromedial branches. Posteromedial and posterolateral, you can see posterolateral, medial, we have just discussed now in the posterior cerebral arteries. Okay, now here I would like to tell one type of aneurysm called as the Berry aneurysm. So what is Berry aneurysm is, it is actually congenitally a thinning of the arterial wall. Especially you will be able to see here the anterior communicating and anterior cerebral, the junction here, most common formation of the berry aneurysm. So aneurysm is an abnormal dilatation. So because the vessel wall is thin, naturally the artery will be bulged here. So if at all there is a rupture, then naturally it might lead to very serious consequences. Okay, so that is about your posterolateral group. They told geniculate, thalamo-geniculate. No, as I told you, supplies your hypothalamus, the two geniculate bodies, and mainly your ventral and lateral group of the thalamic nuclei. So to summarize, your internal carotid artery supplies your mainly your medial and lateral surface of your frontal, parietal, and the lateral surface of temporal and major part of your internal capsule, mainly through its branches from your anterior choroidal, then Charcot's artery, recurrent artery of Hubner. They are all mainly from the branches, one or the other branches of the internal carotid artery, and your major part of your internal capsule and anterior part of thalamus. Whereas vertebral basilar system will mainly supply your brainstem, hindbrain, cerebellum. Okay, posterior part of thalamus, occipital lobe, mainly concerned with the cerebrum. It is the occipital lobe, and to some extent part of the inferior surface. So occlusion of internal carotid produces mainly contralateral motor and sensory loss, whereas vertebral system might produce bilateral motor and sensory deficit. Okay, bilateral is because mainly your cranial nerve nuclei are all situated in the brainstem. So that is why what happens is there will be bilateral effect. Okay, so I think I have completed the not I think I have completed the arterial supply of the brain. So we'll just have a very quick look at the veins draining the brain, the venous drainage of the cerebrum. So veins of the brain mainly they drain into your dural venous sinuses. Okay, so they are thin walled and devoid of valves and drain into the dural venous sinuses. Okay, so superior sagittal sinus you are able to see here, and then you are able to see that is your inferior sagittal sinus, a straight sinus, and that should be your transverse sinus, sigmoid sinus going down as the internal jugular vein. Here you should have a cavernous sinus which is connected to superior petrosal and inferior petrosal sinus. Okay, now mainly they are classified into superficial cerebral veins. So they are cerebral veins mainly, and then you have your veins of the brainstem, then you have the cerebellar veins. Okay, cerebral veins, veins of the brainstem, and then you have the cerebellar veins. The cerebral veins again can be classified into superficial and deep veins. Okay, so cerebral veins can be classified into superficial veins and deep veins. The superficial veins mainly they drain into your superior sagittal sinus. Okay, so thereby continues as right transverse to the right internal jugular vein. Whereas your deep veins mainly drain via the great cerebral vein of Galen into your straight sinus, left transverse sinus, which continues as the left internal jugular vein. So ultimately what I actually mean to tell here is that the superior cerebral veins drain into your right internal jugular vein, whereas your deep cerebral veins drain into your the left internal jugular vein. So we'll have just a very quick look about these veins. First, superficial veins are present as three groups. One is the superior cerebral veins. So the superior cerebral veins they drain the superolateral surface, and from there they go to the superior sagittal sinus. Then you have the superficial middle cerebral vein. Mainly you can see them along the lateral sulcus, posterior lemmus, and then near the central sulcus, there you can see them. So you have pre-central vein of Rolando, and then you also have post-central vein. Okay, so saying the central part of your superolateral sulcus, that is your superficial middle cerebral vein, which drains into your cavernous sinus. and it is connected to the superior sagittal sinus through superior anastomotic vein of Trollad. Same way, it is also connected to the mainly what do you call inferior. Mainly, it is also connected by the inferior anastomotic vein. You also have an inferior anastomotic vein to the transverse sinus. Okay, so that is also there. Then you have inferior cerebral veins. So mainly on the inferior surface, you come across the inferior cerebral veins. So drain the lower part of your superolateral surface, and the inferior surface is your inferior. So superior, superficial, and then you have the inferior cerebral veins. So they again drain into your transverse, superior petrosal and cavernous sinus. Superior cerebral vein mainly drain into your superior sagittal sinus, superficial into your cavernous sinus, and inferior cerebral into your superior petrosal, transverse and cavernous sinus. From the orbital surface, okay, from the orbital surface you have anterior cerebral veins which drain your orbital surface, anterior cerebral vein. Okay, and then also superficial middle cerebral vein, which we have already seen. So this mainly drains your orbital surface. Now coming to the deep cerebral veins. So the deep cerebral veins are again mainly two veins you can recognize. One is the deep middle cerebral vein. Okay, so this is actually your deep middle cerebral vein, drains your insular part. Insular veins you have, and then joins with your anterior cerebral vein. Okay, so the deep middle cerebral vein joins with the anterior cerebral vein to form the basal vein. Okay, so join to form the basal vein. Okay, so you are able to see that. So what happens is, from there you have the anterior cerebral vein which drains your lower part of the medial surface of the cerebrum. So anterior cerebral vein drains your lower part, joins with the deep middle cerebral vein to form your basal vein. Okay, striate vein, anterior part of the corpus striatum. So striate vein is actually drained by the anterior part of the corpus striatum, and one of the branch of the basal vein is your thalamostriate vein. So stria terminalis and thalamostriate vein. You can be see that. So this anterior cerebral vein will accompany your anterior cerebral artery. Okay, and deep middle cerebral vein actually will lie in the stem of the posterior ramus of the lateral sulcus, the deep middle cerebral vein. Okay, um, so basal vein which you are able to see here is formed by the union of anterior cerebral and then your deep middle cerebral veins. So these two join and forms, and the basal vein drains into a very short stem which you are able to see here in the midline, that is called as the great cerebral vein of Galen. Okay, so basal vein of both sides, they drain into the great cerebral vein of Galen. So here you are able to see here, that is your internal cerebral vein. So that internal cerebral vein which you are able to see here, mainly where actually they drain the deeper structures of the cerebral hemispheres. So we form a union of thalamostriate and choroidal veins, and what happens, they join with the opposite side to form the great cerebral vein of Galen. So this great cerebral vein of Galen is formed by the union of two internal cerebral veins. Okay, two internal cerebral veins that form the great cerebral veins. Okay, so short median vein joins with the inferior sagittal sinus and forms the straight sinus. Okay, so it will actually form your straight sinus after the internal cerebral, the great cerebral vein joining with the inferior sagittal sinus to form the straight sinus. Then you have cerebellar veins, mainly veins on the superior surface and also veins on the inferior surface. Superior surface again drains into the great cerebral vein, and inferior surface into straight or sigmoid sinus. Then veins in the brain stem. Veins in the brain stem are in the form of a plexus, and from the midbrain into again to the great cerebral vein, and from pons and upper medulla to either petrosal, transverse, or to cerebellar veins. And lower medulla mainly drains into veins of the spinal cord. Okay, so with this, I have actually completed the blood supply of the brain. So thank you very much for your patient listening, and thank you one and all.